Good afternoon, and happy Asian American, Native Hawaiian, and Pacific Islander Heritage Month. Thank you for joining us today for today's webinar. My name is Nina Ponce, and I am the director of the UCLA Center for Health Policy Research and professor and Wasserman Endowed Chair in the Department of Health Policy and Management at the UCLA Fielding School of Public Health. As a land-grant institution, we would like to begin by acknowledging the Gabrielino Tongva peoples as the traditional land caretakers of Tovangar, that is, the Los Angeles Basin and South Channel Islands. At the center, we are fortunate to have opportunities to get outside the world of academia and work with people in their communities. Today is a wonderful example of that, as we bring together researchers and leaders in Native Hawaiian and Pacific Islander communities to talk about the launch of visualization tools that provide county-level data on health and social drivers of health among NHPI communities. During the last, it's been nearly 4 years now, with funding from the U.S. Department of Health and Human Services Office of Minority Health, the Center's NHPI Data Policy Lab has worked to address gaps in data and research for Native Hawaiians and Pacific Islanders. One of the tools we'll be discussing today is a result of that support. The NHPI Data Policy Lab has been working in partnership with members of the community to create a free online dashboard that highlights data on a variety of topics by California county. We're proud of this dashboard for a couple of reasons. First, it's a critically important resource for communities that have for too long been overlooked in population data. Second, the dashboard is a result of the best kind of collaboration between researchers and communities in which the academics humbly listen to the community's wants and needs. It wouldn't exist without our partners' ideas, feedback, and guidance. This dashboard is designed to help break down the community's barriers to accessing and using disaggregated data. Lab staff have conducted trainings and workshops on data access to ensure that the people who need this data can benefit from it. The second thing we'll introduce are new data profiles developed for Alameda, Los Angeles, and Orange counties. All this available data can be used by community leaders and advocates to fight for resources and policy changes at the local and state levels. At the UCLA Center for Health Policy Research, we're motivated by the idea that there cannot be health equity without data equity. So thank you for joining us as we talk about how we work with others to create and share more equitable data. Today, we'll welcome presenters from our NHPI Data Policy Lab as two community organizations, as well as two community organizations who are here with us, Pacific Islander Health Partnership and Southern California Pacific Islander Community Response Team, or SoCal-PICRT. Before we begin, I'd like to remind everybody that today's webinar is being recorded and will be posted to our YouTube channel in the coming weeks. If you would like a copy of today's slides, please email our communications department, and we have the email here at healthpolicy@ucla.edu. Thank you once again for joining us today. Now I'd like to introduce Calvin Chang, the director of the Native Hawaiian and Pacific Islander Data Policy Lab. Calvin?
Aloha mai kako. Before starting, I'd like to acknowledge those whose work we built upon, including my mentor, Mantika Ala Pang, as well as community leaders who are unfortunately no longer with us, like Uncle Victor Kaiwi Pang and Karen Young. I'd also like to thank Dr. Michelle Brown, our program officer, for her support throughout this project, and for the two community presenters who will be discussing how they have utilized data in their work and why accessible data will remain a high priority for NHPIs for the foreseeable future. Next slide, please. For decades, our community has recognized that data represents a foot in the door with funders and policymakers, because if we don't exist in the data, we don't exist in their eyes. However, NHPI data is often not accessible or easily utilized by our communities. And this is problematic because it means we're at a disadvantage when applying for grants, advocating for more effective programs, and ensuring our communities receive a fair share of resources. The NHPI's Ahead project, which stands for the Native Hawaiians and Pacific Islanders Addressing Health Equity in Data, addresses this problem by working in close partnership with NHPI communities to develop data tools and trainings that specifically emphasize NHPI data. And I'd like to share 3 key takeaways that we learned throughout the Ahead project. The common thread between them is the importance of strong relationships with community organizations and their continuous involvement in the development of data tools and trainings. The first takeaway is knowing where community organizations stand in terms of their capacity to work with data and understanding how they would utilize data if they were available. And that should establish the foundation of the tools and trainings that come after. The second key takeaway is to engage with the community in order to tailor the tools that are meant for them. Many data tools try to accomplish too much, and by trying to highlight every community's data, it makes it hard to find what's being said about our community. But instead, creating tools that are tailored for the NHPI community's data needs, that helps us directly connect data to their intended use cases. And it also directly addresses their specific data challenges. For example, NHPI data is often limited by small sample sizes, which prevents our data from being reported. Other larger communities may take for granted that they will typically be included in reports, and that's not something that our community can do. So ensuring that we can identify that, let community know why this is happening, and also try to find solutions to this is all wrapped up in the development process for our data tools and our trainings. And lastly, we recommend embracing a development cycle that incorporates iterative community feedback. Building something that works and continuing to improve on it instead of simply attempting to build something perfect the first time, which simply isn't possible, is something that we recommend because sometimes community needs may change over time, or sometimes new features may need to be added that weren't there before. So incorporating design elements, running them by community, making changes, and then running them by community again is an essential part of this iterative process to make sure that the product is always going to remain relevant for your intended communities. Next slide, please. The first takeaway, understanding the community's capacity to work with data, was informed by a community data needs assessment that we conducted with the participation of 34 NHPI organizations from across California. Their participation revealed that many of our organizations are heavily supported by volunteers. Staff tends to be spread thin because so many of our community organizations are underinvested in. So the staff are focused on doing what they do best, helping community on the ground, managing programs, fundraising, or focusing on policy advocacy. And this means that the data tools that we developed had to save organizations time and make an effort to guide them towards a better understanding of what the data was saying. What was also extremely valuable was that the organization shared specific use cases for how they would use data if it were accessible to them. Next slide, please. So we tailored our data trainings using what we learned from the data needs assessment. Our partner organizations shared that they wanted to use data for grant writing, program development, and policy advocacy. So we worked backwards from those use cases to develop trainings that first covers fundamental data concepts to help understand data, and then where can data be found and how to use those tools to find them, which included going over instructions on how to find NHPI data on the Census Bureau's website, through the California Health Interview Survey, and through our NHPI Social Determinants of Health dashboard. And lastly, you bring it all together by walking communities through examples taken from real life on how to use their own data to advocate for policies or to write grants or to inform program development. Since then, we've developed 2 intermediate trainings to go more in depth into how to utilize data when presenting to policymakers and how to create basic data visualization, since many organizations would like to develop public-facing materials that educate the community as to the challenges that we face, but also what assets we bring to the table. And so basic data visualizations is one of the trainings that we are offering. Next slide, please. In terms of tailoring our products for the community, this relates to what I mentioned when I talked about how our data often isn't available due to small sample sizes. And so this slide actually comes from one of our data trainings. And what it shows is that there is a significant difference between the census and sample surveys like the American Community Survey, which only look at a small group within the larger population and tries to assume that maybe that small group represents a larger population. But if NHPIs are not in the smaller group being sampled, then unfortunately, our data is often suppressed for privacy reasons or are statistically unstable. And so our training goes over this and also make sure to mention that tools like AskCHIS allows for data to be pooled across years in order to create a larger group within which we can often find data that wouldn't otherwise be available. So this is not a training section that a lot of other communities that are much larger than us have to deal with, but because our community is relatively small, it makes sense to make sure that our trainings are tailored to include this type of content. Next slide, please. And regarding the last takeaway, we utilized an iterative process to develop our NHPI Social Determinants of Health dashboard. Community feedback informed the initial content and design, but we continued improving through various iterations. We made sure that the user interface was something that supported being able to group similar data sets together visually, making sure that there is supplementary language that could better contextualize what the data is trying to say, and also trying to make sure that we reduce the amount of work required in order to get to the relevant data. As it currently stands, one need to click on only the county that they're interested in and the issue area they're interested in to be able to pull up their data. A vast improvement over many other tools out there that require clicking through over a dozen different menus and submenus. With regards to the latest version of our dashboard, next is Shreya Paul, our data analyst, who will discuss the latest version and other important data tools.
Thank you for the introduction, Kevin. Today we are releasing 2 very important data resources for the NHPI communities, and I will be presenting about them. The first one is the Native Hawaiian and Pacific Islanders Social Determinants of Health dashboard, and the second one is the County Data Profiles. Here's an exciting update that we have been working on. Our Native Hawaiian and Pacific Islanders Social Determinants of Health dashboard has a new look. Our team has designed the dashboard to be more user-friendly, visually engaging, and informative. Additionally, for this launch, we have updated the dashboards to use the latest data available on data.census.gov for our communities. As Kevin mentioned that this is an iterative process, for this iteration, we are releasing the statistics and visualizations for the top 10 counties by NHPI population, which is shown on the screen. Statistics for additional counties will be added in the next few months, so more coming soon. Stay tuned. Some of the issue areas or indicators that are on the dashboard are demographics, voting age, age and gender, prevalence by disability, by race and ethnicity, NHPI age groups, economics, poverty, income, occupations, and so on. For education, we have K to 12 enrollment statistics as well as higher education status. For health, we have general health status, insurance status, as well as other health indicators such as visits to the ER. For housing, we have home ownership status, marriage, and living with relatives. as well as we have statistics and information available on veterans by NHPI subgroup categories. We have also optimized the dashboards for viewing on mobile browsers. There is no app needed to view the dashboards. The browser is sufficient. And we have added tablet view to the dashboards. That means that the dashboards can be viewed on tablet in landscape view. Again, no app needed. So now I'm going to do a small dashboard walkthrough for which I'll stop sharing my screen. So this is what the Native Hawaiian Pacific Islander Social Determinants of Health Dashboard California counties look like. This has been developed by our NHPI Data Policy Lab at the UCLA Center for Health Policy Research. To go through the dashboard, the first step that we need to do is select a county from the list of counties given below. For this presentation, I have selected Alameda County. In the second step, you can select an issue area. For this presentation, I'm selecting demographics. And after selecting the county and the issue area, I can see the different statistics and visualizations available for the issue area for that county. For example, our first chart shows us the total NHPI population in Alameda County. And below that, we list the source, such as the US Census Bureau 2020 Decennial Census Table P1. That means this chart comes from this source. On scrolling down, we can find more such statistics on the demographics of Alameda County. Another chart shows the total detailed NHPI group populations in Alameda County, lists the source of the information, and shows the population estimates for Chamorro, Fijian, Native Hawaiian, Samoan, and Tongan subgroups in Alameda County. Now, if I want to see the same information for a different county, I can go back to my step 1 and select a different county. For example, I'll select Los Angeles County, and we'll see that the dashboard updates for Los Angeles County. Similarly, for exploring a different issue area, we can click on the different issue area tab. For example, if I click on economics, it shows me economics and poverty, visualization, and statistics. So this was a small walkthrough of our dashboard, and I invite you to explore the dashboard by yourself. And if you have any feedback for us for our next iteration, please let us know. Going back to our presentation. So the next resource are the NHPI Social Determinants of Health Data Profiles. These profiles draw from our interactive dashboard and provide a snapshot of health and well-being across NHPI communities using detailed county-level data. Each data profile is 3 pages long, and the first 2 pages present subgroup statistics for the county, in this case, Alameda County, and the third page provides the data sources as well as any data notes if present. Each profile presents data specific to counties with significant NHPI populations. Using the profiles, you can provide a quick snapshot of the diversity within the NHPI community, Native Hawaiian, Samoan, Tongan, Fijian, Chamorro, through subgroup level data. Social determinants of health topics are covered, such as demographics, education, poverty, housing, health, and disability. The data profiles have visual and accessible format. Graphs, maps, and charts make complex data more understandable for community use. And these data profiles are tailored for action. County profiles can be used by local leaders, advocates, and residents to identify disparities, and drive policy or resource changes. So today we are releasing 3 county profiles: Alameda County, Los Angeles County, and Orange County. Please contact us if you need custom profiles for any specific counties. And with that, we will be hearing from 2 of our community partners. Please join me in welcoming Sydney Pike, Policy Lead at Pacific Islander Health Partnership. Welcome, Sydney.
Mahalo, Shreya. Aloha mai kakou, everyone. My name is Sydney Pike, and I'm currently serving as the policy lead for Pacific Islander Health Partnership. Mahalo to the lab for all the wonderful work that you do, and for also inviting me to come speak about our organization and why data is so important for the work that we do. Next slide, please. Thank you. So Pacific Islander Health Partnership was founded in 2003 by Auntie Jane Ka'alakahikina Pang and Uncle Victor Kaiwi Pang. And they both recognize the growing health disparities affecting Native Hawaiian and Pacific Islander communities, especially from illnesses like heart disease, cancer, and diabetes. They envisioned a world where NHPIs could thrive in communities rooted in culture, care, and connection. We are now in our 22nd year of service, and PIP currently stands as a 501c3 nonprofit based in Santa Ana, California. We serve the 5 larger NHPI populations in the state, including Chamorro, Native Hawaiian, Marshallese, Samoan, Tongan, and the hope of expanding services to our growing Fijian community in the future. Our programs are grounded in cultural competence and community leadership and include things like culturally based healing and education, senior wellness, youth engagement and development, research, policy advocacy, and the heart of our work, which is our Pacific Islander Navigators, or our PINs. And this is our version of community health workers. Our PINs are trained bilingual navigators providing in-language health services and resources to community members in the Orange County and LA County region. So our work is guided and shared by ancestral values like compassion, stewardship, unity, humility, and cultural responsibility. And we really believe that addressing NHPI health disparities means showing up with cultural integrity, building trust, and recognizing the unique barriers that shape access to care for NHPI communities. Next slide, please. So the mission of our organization is to serve multi-generational Native Hawaiian and Pacific Islander communities by nurturing an environment for overall health equity and wellness through direct services, outreach, education, and advocacy. Our vision is to create a world where Native Hawaiians and Pacific Islanders flourish in the richness of our shared identity, honor our cultural protocols, and nurture a community where everyone can thrive. Next slide, please. So at Pacific Islander Health Partnership, we understand that meaningful, sustainable change doesn't just happen in isolation, but it really happens through trusted relationships and strong partnerships. So collaboration really is at the heart of our work. And by partnering with organizations that share our values, understand our communities, and face the same challenges, we're able to reach more families, offer more culturally grounded services, and build lasting, trusting relationships with community members. So PIP convenes a network of dedicated partners to deliver direct services to our 5 communities. And some of our partners, just to name a few, include Couture and Chamorro Foundation, Marshallese Youth of Orange County, Ainahau Okaliponi Hawaiian Civic Club, Lake Afa, Samoa Matalasi, the Young Samoa, and Family Petaha. So these partnerships really allow us to multiply our impact, expanding access to care and ensuring that our communities, each one of them individually, are seen, heard, and served with dignity. So we really are stronger together, and we're extremely proud to walk alongside these organizations in advancing health equity for our Pacific Islander families. Next slide, please. It's also really important for us to recognize that addressing NHPI health disparities requires a really clear understanding of the complex relationships our communities have with the United States. So, as illustrated in this map, our Pacific Islander communities come from diverse island nations, each with its own unique legal and political relationship with the US. So, these relationships result in a wide range of citizenship and immigration statuses that directly impact access to healthcare, public benefits, and other essential services. So whether US citizens, nationals, or migrants under the Compacts of Free Association or COFA, our communities face different barriers to care that we need to navigate. Next slide. So over the course of 22 years, we have evolved to provide a wide range of services. And this is just a couple of snapshots of various events, workshops, and community organizing we've done. Health is about more than just what is physical, but also how we can foster stronger community relationships, which is exactly what PIP has built over the years and what we continue to always strive for. So we're really proud of what we started, where we've come from, where we're going, and also the visions we have for our future. And we hope one day to be able to expand to create community health centers or even weaving traditional healing practices into medical practice. Next slide. But how can we get to these futures, to our visions, and most importantly, to our reimaginings for our community? And that's through data. So data is not just about measurement, but it's really about power, visibility, and justice. So for NHPI communities, the lack of accurate disaggregated data is one of the most persistent barriers to health equity. When we're left out of data sets or aggregated in larger categories, our communities are often rendered invisible to those who are shaping policy, allocating resources and funding, and designing medical interventions. So without data, we can't justify the need, and without visibility, we can't gain access to resources. So a lack of data for our communities could actually make the difference between life and death. So during COVID, for example, the misrepresentation of the vaccination rate being over 100% in our NHPI communities meant we were not prioritized in outreach efforts, despite our communities having rapidly increasing death tolls from COVID and being one of the largest ethnicities affected. So health outcomes, funding priorities, and legislative agendas are increasingly being driven by data. And this is a constant uphill battle for NHPI organizations, not just to respond to disparities, but to even prove that those disparities exist in the first place. So we really rely on data to make our case for equitable investment, design culturally grounded interventions, track outcomes and impact over time, inform policy and system change, and empower our communities to tell their stories with credibility and strength. So lack of community context also reinforces poor health outcomes for us. So we've been left out of mental health and other prevention funds due to lack of culturally sensitive approaches when it comes to the collection, analyzing, and dissemination of data. So certain measures are not the most important for our communities. So for example, when we were working with mobile vaccination clinics, the initial threshold for individuals eligible for vaccines was 75 and older. However, life expectancy for our PI communities was much lower due to the devastation of death rates from COVID on our elders. So this lack of understanding and different nuances made coordination and action extremely difficult, especially when already compounded by inaccurate data. So collecting and using data is not straightforward, and especially for organizations like ours that are often under-resourced, we definitely face barriers in accessing, cleaning, and contextualizing this data. Next slide, please. And it's not just important to have data available, but it's also important to have control and be able to organize our own data. So being able to highlight our work is crucial to communicate our impact. So here I've just pulled some numbers from our 2024 data highlighting the incredible work of our Pacific Islander navigators and how many community members they've consistently served. So we have the total number, which was about 890, and we've broken that down by gender, by ethnicity, and by age. And we collect data not just to track participation, but it really helps us refine and frame our programming, identify gaps, and advocate for resources. And owning data puts power back in our hands. And data has been a super important aspect in my role within policy advocacy and informing and directly engaging with legislators. It's important to communicate our needs in a way that matter to different audiences. So there's a fundamental difference in the way community talks and the way legislators and policymakers talk. Oftentimes they don't understand community, so it's important that we can speak their language, and a lot of times that heavily involves data. Next slide, please. And going off of that, different data forms are also extremely crucial. So our NHPI communities are known storytellers, and data cannot speak for itself alone. So to truly understand our needs and impacts, we need both. And this is our impact. So these are some statements pulled from youth from our different youth programming. And all of these statements are why we do what we do. At the end of the day, PIP really does create and sustain community. And our community will continue to make do with what we have and will continue to serve where we are needed or called upon. But for a group that has accomplished so much with so little, I can only imagine what we could do with more data, greater access, more funds, and more resources. So we could have this. We could have what you see on the screen times 10. Having the data gets us closer to realizing this and realizing our vision of a thriving NHPI community. Next slide, please. So I just want to say thank you. So mahalo to everyone for your time. And now it's my pleasure to introduce Isa Sasi, the advocacy coordinator for the Southern California Pacific Islander Community Response Team.
Thank you, Sydney, for the introduction. Talofa lava. As she said, I'm the advocacy coordinator for SoCal Picker. Here are just a few photos of our coalition. And then you can go next. Just a little background on SoCal Picker. We are a coalition made up of 20 Native Hawaiian and Pacific Islander community-based organizations in SoCal, serving from Central Valley all the way down to San Diego. We came together as a response coalition because there was not a lot of resources for any of our orgs to be supported throughout the pandemic. So this was our way of pulling whatever resources we had together and a way for us to be efficient. The sheet doesn't reflect all the orgs we work with now. We have grown since then. And then you can go next. And then I just wanted to share one of our first major wins as a coalition. It came early in the pandemic when we were alerted that our community had the highest cases and deaths amongst all ethnic groups. We noticed that while data was being reported on COVID-19 across various ethnicities, Native Hawaiian and Pacific Islander data was missing entirely. We brought this concern to Dr. Paul Simon when he was Chief Science Officer at the LA County Department of Public Health. And we urged them to report NHPI-specific data, emphasizing that it's important for our community to see themselves reflected in public health reporting. The barriers that we faced was that our population numbers didn't meet the threshold for separate reporting. So we ended up pushing back and saying that we couldn't afford to lose another life just to prove what was happening in our community. So from there, we basically partnered up with some of our coalition orgs and helped them advocate within their own counties to report NHPI data. And because of that early success, we understood the power of working together, and we've just stayed united ever since. So here's just a few photos from our community throughout the pandemic. And then you can go to the next slide. Oh. And then also throughout COVID, what we were able to do was mobilize quickly to connect our communities to these critical resources. Thankfully, our trusted relationships within community allowed us to navigate people to like COVID testing, vaccines, financial aid, or any vital support. And then aside from being a coalition throughout the pandemic, we realized that there's a significant gap in direct services for our community in LA County. So it being home to the largest NHPI population outside of Hawaii, in response, we've been actively working to build out these services. So just going into our programs reflect our role as community navigators, or I would like to say like weavers, because we're a coalition. Our first program is Pacific Power, which is the environmental justice component of SoCal Picker. They started off with guiding community towards city initiatives like green energy and other climate-related efforts. But recently we hosted a community screening featuring one of the Pacific's leading climate activists, Brianna Faruian, partnering with El Camino College, drawing over 150 attendees. This event it basically followed a 3-month series of beach cleanups focused on raising awareness about ocean health. So we're currently building out this program to continue to educate community on climate justice. And then our second program is Pacifica Wellness. It's our mental health and wellness program. Navigating mental health is a critical need in our community, especially in the aftermath of COVID-19. We've lost so many loved ones, and the impact of loss continues to affect us deeply. Pacifica Wellness is actually one way we're working to address this issue. So our goal is to expand this program and provide culturally rooted mental health services to Pacific Islanders through SoCal Picker. One of our team members is actually a licensed clinician. So we do aim to create opportunities for her to offer services to our community firsthand. And then we also were able to partner with UCLA and UCI on mental health research projects to generate data that highlights community needs and helps inform effective data-driven solutions. We also realize that it highlights community needs and helps validate those disparities amongst our community in which they face firsthand. And then our third program is Pacific Pathways. It began with the focus on opioid awareness, but has since expanded to meet broader community needs. In response to the impact of COVID-19, we expanded this program to help small businesses navigate available resources for recovery and growth. We also support families by connecting them to essential housing services and assistance. And then some of these photos is from our beach cleanups, and then the resources we're able to share. And then under Pacific Pathways, they have a podcast on YouTube highlighting small businesses and community. And then you can go next. And then up next would be our policy advocacy programming. What that looks like is collecting over 50 community letters for the OMB race and ethnicity standards update, collecting letters for bills that benefit our community. For example, our language access bill, AB 1242, educating our legislators on data to prove why we need bills passed for our community, or why our community needs to be prioritized. And then language access was something that was developed over the pandemic. We translated a lot of COVID resources to reach our community, and we are currently translating over 40 documents for the LA Department of Public Health and creating a training for medical interpreters. And then the last thing is coalition building, healing tides and communications. So healing tides is a restorative program where healing and renewal initiative for 9 org leaders within our coalition to sustain leadership organizations. And then for communications, one of our ongoing efforts is to develop and share content to keep our community informed. We rely on data from the NHPI Data Policy Lab dashboard. And through my work, I found that many of our partners only use this platform due to not having enough alternative resources. And then during the pandemic, we launched a newsletter called Amplify to provide updates on events, resources, and important developments. Through this platform, we also share community data reports to ensure our members stay engaged and empowered with relevant information. And then you can go to the last slide. And then this is just like a collage of the way that we weave data into our work. Data has been central to SoCal Pickers since the very beginning, and it continues to guide every aspect of our work. We use data not just to inform ourselves, but to tell stories that reflect the realities that our communities face. So one of our first efforts was sharing weekly COVID-19 data, which we tracked for 2 years until counties stopped reporting. This early work laid groundwork for using data to support advocacy, planning, and education. Understanding that our community already knows its challenges, data validates those lived experiences. So through social media, newsletter, and research, we use data to inform both our community, our legislators, and public agencies. It also boosts grant writing and highlights resource gaps, although a lack of disaggregated data remains a barrier. For example, the state once claimed API youth weren't a priority for suicide prevention funding due to using insufficient data. But our data showed otherwise. Suicidal ideation surfaced unprompted in our research. With a growing diverse community, data showcases the culturally specific details and insight. The data makes it clear, the needs are real. Data isn't just for numbers, it's the evidence behind our advocacy, the backbone of our programs, and the mirror that reflects our community lived truths. It's how we make sure our voices are not just heard, but also counted. So, Fafatai Telelava, I will also pass it over to Tiffany for Q&A.
Good afternoon, everyone. My name is Tiffany Lopes, and I'm the Communications Director here at the UCLA Center for Health Policy Research. I've been posting some links in the chat, and I'm going to be going through the audience questions today. Please, if you have any questions, if you could use the Q&A function in Zoom, that would be great. Thank you. So first question. I see Sacramento is the only Central Valley County on the new dashboard so far. Great start. How can CVPIA, which is the Central Valley Project Improvement Act, help to get more Central Valley counties on the dashboard and for county profiles, please? Calvin?
Yes, apologies to CVPF for the lack of the representation of Fresno County on the dashboard for now, but it is definitely in our work plan to make sure that we expand the dashboard to all of California's counties, and we hope to be able to include Fresno for sure within the next month. And we also intend to gradually release more county profiles as capacity on our end frees up. But we would love to work with you to develop a Fresno County profile that highlights some of the data needs on your end.
Thanks, Calvin. And just along those lines, someone had asked if they could request a county profile, who they would be able to contact for that. But also a thank you for all the work you're doing for our peoples, they said.
Yes, please feel free to contact myself, and I can work with our team to work with you to see what we can do about developing those data profiles. As of now, the AHEAD project is formally going to be closing in June, but we are looking to sustain it through other funding sources, and our staff will continue to remain very involved in trying to make sure that these data tools hopefully continue to be updated and that we can continue to meet our NHPI organization's data tool needs.
Thank you. What are some additional data or data sets that could be helpful?
I feel like I'm talking a lot, so if anybody else would like to step in, please feel free.
I can.
Yeah.
I can
Oh, sorry.
No, Sydney, you
Go ahead.
Go ahead. You're the consumer of this, so go ahead.
Yeah, I think some additional data points that would be super helpful. I think Isa and I both kind of touched on it in our presentations, but mental health is an extremely growing issue in our community. And it's kind of been a hidden issue for a long time. And I think we both kind of talked about the importance of like cultural sensitivity when it comes to approaching these topics, especially when it comes to research, because in the way you ask questions about mental health, it's super hard to capture the actual effects and symptoms that NHPI communities are facing due to the stigma that surrounds the conversation in our communities. And I think the lab has been doing a really great job of expanding that. Like I know with the recent release of the CAPI Waves report that came out of the NHPI Data Policy Lab, that was something that is super critical to help us in kind of navigating how we should frame our approach towards creating programming around mental health for our communities. And it's also something super helpful in just addressing, like identifying that there is a need for us, because like I think Issa mentioned earlier, like we have been left out for so long because of the focus on factors that don't really encompass our community.
Thanks, Sydney. Inez, was there something you wanted to add there?
I think Sydney covered it, that the mental health insights are very important. But I think the mention of CAPI waves suggests also that perhaps community community-led assessments and not just the population surveys from states and from the federal government is something that we would like to incorporate. So that's especially at a time when some of the federal data sets may be threatened in terms of collecting more granular data on race and ethnicity, as well as on other dimensions of identity, such as sexual orientation and gender identity. So I do think that it's important to also advocate that. And I know Calvin and his team had a hard time finding data sets where we had to pull so many years of data. Sometimes you had to get to restricted data space to get at the Native Hawaiian Pacific Islander community. So there's just such high transaction costs in doing this. And so the advocacy from especially those of you who are community leaders in making sure that data sources on social drivers of health are represent and are inclusive of the populations that typically are not seen in reports, I think it's really important. I just also wanted to say thank you, a shout out to there's so many people that we know in our journey on data equity. So I don't want to single out any one person, but I see you and I thank you for supporting us.
Thank you. There's actually another question sort of related to this. So I'm wondering if we can hear maybe from Calvin, with all the changes with DEI and the pulling of data from CDC, as well as the suspension of equity measures at CMS from the federal level, how will that impact the lab's ability to pull data for NHPI?
It's of great concern to us. Some of these data collection efforts are managed by the Census Bureau in conjunction with these other federal agencies. And it's extremely important that these national data sets remain available because they're oftentimes the only source for many of these issue areas. The federal government's resources have enabled federal agencies like the Census Bureau to cover our communities at a granular level that simply hasn't existed elsewhere. So we really hope to work with our representatives to make sure that they understand the importance of continuing to collect granular data for Native Hawaiians and Pacific Islanders. But we are also advising legislators at the state level of the importance of making sure that our communities continue to be represented in state agencies as well through data collection forums, but also in how we're reported. We're very proud of the awareness we've been able to raise in terms of making sure that NHPIs are getting the attention they need, but there's always more to be done, and the work isn't over.
Thanks, Calvin. So we do have some questions about data collection methods. The questions are just rolling in. We have 12 open questions right now, so I'm going to try to get through as many of these as I can. This is sort of a two-question. How are small sample size limitations addressed when developing NHPI data tools? And can you elaborate more on the data collection methods? So standardized questionnaires for all counties to enable meaningful comparisons and to enlarge sample sizes.
So we currently rely on publicly available data sets from the Census Bureau's Decennial Census, American Community Survey, but also California Health Interview Survey, and state agencies like the Department of Education. So it's really their survey data that we rely on, and they utilize standard data questions that allow, in some cases like FIS, to be able to pool that data. So that's one way in which we attempt to address a small sample size issue through data pooling. But we also engage in other data collection efforts as well. For example, we have another project that was led by Dr. Brittany Mori at UCI, known as the CAPI Wave Survey, which utilized respondent-driven sampling methods, which I believe collected nearly 1,000 responses from Native Hawaiians and Pacific Islanders in California in 3 to 4 months, which is an amazing figure for such a small community. And I know that there are efforts at NORC to also construct panel surveys for the community as well. So there are other alternate methods that we hope to explore if funders are willing to help support it.
Great, thank you. This question is for everyone. Who needs to see or learn about this data?
I can go into this. I think for so-called picker and the work that I do in advocacy, the main struggle that we're having is connecting with public agencies, and I think public like in terms of like being a prioritized population, so maybe public agencies and then policymakers need to see this. Yeah.
Thank you. Does anyone else want to add anything?
I think just to quickly jump onto that, I'm going to agree with Isa, but I definitely want to emphasize our policymakers. I think a lot of times, like we kind of touched on, it's really easy for our communities to just kind of become invisible when we're not included in data. And I think that's how a lot of these systems kind of work off of, is just numbers. And a lot of times, sometimes our stories can get lost. So I really do think it's important to kind of have that at the forefront. That way we kind of get the attention that we've been needing so desperately and that we deserve as well.
Thanks, Sydney.
If I could just add to that, for us, data really represents just the start of the conversation. It can represent the place setting, but without the stories behind it, it's hard to understand how we got to where we are. And so I believe data should represent a door opening to learn more about our communities. And what we saw from both Isa and Sydney's presentations is that although we're a relatively small community, the Native Hawaiian Pacific Islander community has been an integral part of how this country has developed over the past few hundred years. And I believe that the stories that our community has to tell are really at the forefront, whereas data is often used to support those stories, to show that those stories that we talk about when it comes to our families, when it comes to our communities, that the data shows that those stories are actually representative of the larger whole. And so we invite all of the participants here to actually also reach out to Isa and Sydney and their respective organizations to learn more about our communities and why the data looks the way it does.
Thank you, Calvin. So this question is for Isa and Sydney. Are there opportunities to partner and collaborate with organizations that are not NHPI exclusive, but inclusive to support NHPI data equity efforts?
Of course. I think for SoCal Picker, we are always looking to partner with others. I think working alongside under the AA NHPI umbrella, it's important to build solidarity amongst both communities, understanding that both communities have similar disparities. So yes, we're always open to collaborations with our Asian brothers and sisters.
Thank you.
I'd love to highlight a collaborative effort between the NHPI Data Policy Lab and the Children's Partnership. I believe that represents it represents what in my mind is an ideal method of working together to ensure that Native Hawaiian and Pacific Islander data is presented well, that it's disaggregated, that it's accurate, that we've worked with the Children's Partnership to ensure that the language used to describe the data isn't misleading. And we would love to have these collaborations with other organizations.
And I am going to find the link to the A Child is a Child fact sheets for folks to be able to put into the chat. But let's get through a couple more questions.
Oh, sorry, Tiff. I also just want to first acknowledge Dr. Brown is in the audience, who has been our supporter and champion project officer for OMH ahead. The project is about data intermediaries, and I think as you've seen here, as Calvin and Shreya and thank you, Sydney and Isa have demonstrated, is that we're scraping the data, we're presenting it in a way that is understandable, but it's really about narrative change. And so that's the point of the intermediaries. We also are pretty strong coders. So we have also helped some other groups creating a dashboard on their own. I think it was Bar High in the Bay Area. So it's really, we want to free the information. We want to democratize information in the service of improving health for Native Hawaiian Pacific Islanders, as well as other populations. The American Indian Alaska Native populations in another example, where we don't see as much data. So I just wanted to thank, and a lot of you here have been part of this data equity movement. So I just wanted to thank you. And Calvin is, I think, it has all the unique talents of a data scientist, community advocate, leader, narrative change activist. So do come to us if you would like to continue, in this journey of democratizing data.
Thank you so much. There was a question about training. What training resources are available to develop and implement culturally relevant practices specific to Pacific Islander community needs?
I think the first step is to build relationships before an ask is made. And that really reinforces the importance and genuineness with which the relationships are built, instead of treating them as something transactional or limited to just a specific project. Native Hawaiians and Pacific Islanders are an extremely diverse group with their own languages, cultures, and traditions, but they have cultural affinities they share. And one of those things that is shared is this value, the value of strong relationships, because that determines how you treat other people, whether you understand the values of the people you're working with, and whether you understand their history that they bring with them. And once you understand that, I think so much can flow out of it. So I would definitely take that as a first step, building those relationships, going to their events, showing face, and then starting to learn more about the nuances from after that. But the first step is always building those relationships.
Thank you, Calvin. I think that's a wonderful way to end this webinar. I know we didn't get through all of the audience questions, so I'm going to drop our link in the chat, healthpolicy@ucla.edu. You can also email me, and I will make sure that I get your questions off to the folks who need to answer them. So thank you so much for attending this webinar today. We will be posting it online on YouTube in the next about week and a half or so. So you can look out for that. And just, again, thank you so much. We appreciate you. Have a great day.